Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way things are. Tall tales will take you.
Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I know you get me twice today. Originally, when I came on, I was supposed to do a video on my testimony this morning before the Oversight Committee that was before Chair Gale Brewer. And one of the things that they were focusing on today was getting the city, passing a resolution to get the city to release the documents that they've been holding confidential regarding what the city knew for 9/11 health, 9/11 air quality, what the city knew and when did they know it. So this has been an ongoing battle, and every mayor since Giuliani kept saying that they weren't going to release the air quality records or what they knew, those records pertaining to that issue, because they were afraid that there would be the city would be held liable. So it definitely made he told everybody actually that the city knew. And if they didn't want to release them, this was a reason why, is that they were fearful of getting sued. Well, one of the first panels was the fire unions and the lawyers that actually filed the lawsuits and the FOIA cases against the city to try to get the documents. And they kept being told that their documents aren't there or they don't exist. But we know that they do because our congressional leadership has actually seen them. So we wanted to participate in this because we feel that there's an ability to tie together this issue with why New York City employees, retirees have been sick from World Trade Center. And then, of course, with the New York City healthcare plan, where the mayor is trying to force us off of our Medicare benefits and now diminishing your access to health providers or access to healthcare. So we wanted to be able to tie the two together. I was a little frustrated with this panel because the chair, Gale Brewer from Manhattan, is chair of the Oversight Committee, and I had submitted my name multiple times yesterday and then again this morning to speak before this panel. Now, you had two panels. You had three. You had the people that spoke, that were testified, actually, regarding some of these issues, because it was also a police issue and then this issue. And then you had the unions that were there to speak, and then you had the public. Further disrespect for retirees, I was put in with the general public. Not that there's anything wrong with that, but I should have been put in an official capacity to speak with the rest of the unions on this issue, since we represent retirees. And when I signed up to speak as an organization. That didn't happen. But regardless, I also noticed that they were given more time than I was given. And strictly because you were on a Zoom call, they limited you immediately to 2 minutes. Now, Gale saw me. She had to know who I was. I announced who I was. She sees me just like you do. And I was like 3 paragraphs off of my testimony. They cut me off. So I was a little frustrated by that. I did email it to her and I emailed it to City Council, but I do want to read it here because I want to make sure that it is like entered into the public record. I want to put this as many places as I possibly can. And yes, you can go onto the New York City Council website, go to the calendar. You'll see today's hearing. There was, I think, 2 hearings today, but this is the Oversight Committee, and it started at 10 a.m. And you'll be able to click the video link and watch the entire hearing. And it was only a couple hours long. I want to say maybe 3 hours altogether. You'll hear the DOI speaking in the beginning, the union, some of the public, and you'll hear me as well. And there was only like maybe 6 of us that were on the Zoom call. So I want to pull up my testimony and I want to read that. I want to read it to you. Okay. So I submitted this just so you know, and this will also go into the record. I said, thank you for allowing me this opportunity to testify, Chair Brewer and City Council. My name is Mary Ann Pizzatola. I am president of the New York City Organization of Public Service Retirees, which represents 250,000 municipal retirees. In our organization of tens of thousands of retirees, we have both first responders and civilian 9/11 responders with 9/11 World Trade Center health conditions who must rely on their health insurance for health care and may or may not be participants in the 9/11 World Trade Center Health Program. Like first responders, these forgotten heroes of 9/11 who kept the city running were also betrayed by the US EPA and then Administrator Christy Todd Whitman, who said the air in Lower Manhattan was, quote, safe to breathe. Of course, the Giuliani administration was completely complicit in constructing this false narrative. A subsequent EPA Inspector General report confirmed the agency had absolutely no scientific basis upon which to base that assertion, and that this agency actually suppressed data that showed toxic asbestos levels were off the charts. Thousands of civil servants were ordered back to their desks at places like the Dinkins Municipal Building, at 1 Center Street, or 250 Broadway. There was no Zoom in 2001, yet these workers, some of whom have died since, were not able to establish that they were first responders and were not eligible for the annual health screening granted to first responders through the 9/11 World Trade Center Health Program. They had to display symptoms, first, which of no doubt had life-altering consequences that the city of New York would like to avoid taking responsibility for. Mayor Giuliani and then Mayor Bloomberg prematurely ordered New York City employees back to work whose work locations were in the zone. All the documents that have been kept secret since Mayor Giuliani was in office on 9/11/2001 must be released. Every mayor since has hidden these facts from the light of day, most likely because they knew darn well that they made a calculated decision to put our lives at risk to keep the city running and get Wall Street to reopen at the expense of our health and lives. The current administration said that they are worried about the potential liability of releasing the 9/11 World Trade Center files. Meanwhile, starting with the de Blasio administration right up through the current administration, they have compounded the EPA betrayal by attempting to force us off our traditional Medicare and onto a predatory Aetna Medicare Advantage plan. If the City Council does not act on Intro 1096 protecting our access to Medicare, they will be compounding the original EPA and Mayor Giuliani betrayal that has already led to thousands of premature deaths. We rely on our doctors and hospitals and cancer and transplant centers to stay alive. We rely on traditional Medicare to get the treatment our doctors prescribe, not a for-profit insurance company forcing us into managed care to decide whether or not I get my treatment or a test timely to determine if we need medical intervention. We are sick and dying at greater rates than the general public. Mike Lerai came to New York City from Oregon with his incident management team to help the FDNY. Last year, as a result of his 9/11 exposure, needed a double lung transplant. The World Trade Center program didn't have a doctor in Oregon, so he and his wife had to go to Arizona for care. The World Trade Center program also has a narrow network and prior authorizations that we had to help them fight so he could survive and get that transplant after months of fighting. Then do the same fights to get his maintenance medications, all because the 9/11 program is owned by a for-profit private equity company, the Carlyle Group, Sedgwick. Aetna Medicare Advantage, the privatized managed care plan that the mayor is trying to force us into, also has a narrow network and prior authorization that is denied to delay and deny our care. And today we have retirees, both responders and survivors, struggling to access care. Get the city to release those 9/11 documents and end the cover-up and pass Intro 1096 to preserve our access to Medicare benefits. You owe us that at least. And so what we did was they cut me off basically right before the last couple of paragraphs. And I wanted to be able to, get that information into the record. So I'm reading it here. I'm also sending it to the council. And I sent it to Councilwoman Brewer, and she already acknowledged that she did receive it. No, Neil, we're not done with this Medicare Advantage fight. That's still in court. We're still going on. This is not ended. I don't understand why people think this is over. This is far from over. We're still fighting the copay case, and we're still fighting the nuclear option where they're going to try to force us into Medicare Advantage. So this video is strictly about the testimony that was today at the hearing on oversight that was chaired by Councilwoman Gale Brewer. And I just want to put this out here so that we could share this. You know what was said and why it's important to keep protecting our Medicare benefits is because we still have retirees that had this very egregious exposure to toxic chemicals that we have to make sure that they get the care that they need. I'm in the Zadroga plan. However, even nationwide, we're having, like I told you about Mr. Lurai, doesn't have access to doctors and hospitals. And then it comes at a cost to them. Now, if you're a civilian, you have to use your private health care in order to get that care. Zadroga won't cover you, which is insane in itself that happens, that there are these two standards, whether you're a first responder or not a first responder. So this is where preserving the health benefits that you have is mission critical. So yes, we are still fighting to protect Medicare benefits. Yes, that is still in court. Yes, that is yet another reason, because we know that the city lied to us about everything. And then to try to steal our healthcare benefits, that's even more of a problem. We need more publicity. Thank you for the fight. You're welcome. So that's it, folks. I want to keep this short and sweet so people will actually watch it. Please share this with your elected officials. Please share this with your city council members. Make sure that this message gets out. It's very important. This is yet another reason why we have to protect our healthcare benefits, because those of us who are not even responders, are civilian survivors of World Trade Center exposures, they for sure need their healthcare benefits. Responders too, don't get me wrong, they do, because before your health issue is certified by the World Trade Center program, you're using your private healthcare in order to get your health, your whatever diagnosis, your symptoms identified as to what they are. So if you're in a managed care plan and let's say Aetna refuses to give you a test and you believe you might have cancer, and they say, no, wait 3 or 4 months, maybe we'll do a test then. You're waiting 3 or 4 months, and that diagnosis can mean the difference between life and death. This is why you need traditional Medicare, so that when your doctor says, I want to do a test, I'm concerned about something, you get it. You don't wait 3 months for it. So we're still fighting, guys, and thank you for being on this road with us. This is yet another talking point that you guys can use in your advocacy, and hopefully, if the city council is watching this, they are learning with you. Have a great day, everyone. Have a good night. See you tomorrow.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way things are. Tall tales will take you very far. Don't scoff when they say it's the end. In this life, you know you can't pretend. The days pass by, they've set in stone. But it's not too late now for you to change your tone.